Hey everyone, Dr. Mike here, and welcome back to the Interpreters Academy of Jacksonville's channel. Today, we're tackling a critical topic for aspiring medical interpreters: medical abbreviations. They're the secret language of medicine, and mastering them is key to accurate and efficient note-taking and interpretation. First up, we have MRI, which stands for magnetic resonance imaging. A patient walks in describing dizziness and headaches. The doctor orders an MRI. An MRI uses powerful magnets and radio waves to create detailed images of organs and tissues. OTC stands for over-the-counter. OTC medications can be purchased without a prescription and are safe when used as directed. Let's delve into the world of nuclear medicine with PT, positron emission tomography. This test uses a special radioactive tracer to highlight areas of high metabolic activity like cancer cells. Deciphering the patient's story. SX is shorthand for symptoms. Imagine a patient describing fever, chills, and a persistent cough. Symptoms are subjective experiences providing crucial diagnostic clues. WNL, the Reassuring Acronym. WNL stands for within normal limits. It means the test results are within the healthy range. A decision with consequences. AMA can mean American Medical Association or against medical advice. Let's focus on the latter. Imagine a patient leaves the hospital AMA against the doctor's recommendations. Let's talk about a vital sign you're familiar with. BP, short for blood pressure. Blood pressure is the force of blood pushing against your artery walls, measured in millimeters of mercury, mmHg. Now for an abbreviation relevant for medical billing and coding, CPT, which stands for Current Procedural Terminology. CPT codes report medical, surgical, and diagnostic procedures, essential for insurance reimbursement and tracking healthcare statistics. Understanding these codes ensures accurate billing and data collection. Let's explore CT or computed tomography. CT scans use X-rays to create detailed images, crucial for diagnosing injuries. DX, unlocking the medical puzzle. DX stands for diagnosis. It's the identification of a disease or condition based on signs, symptoms, and test results. ICD, the global language of disease. ICD stands for International Classification of Diseases, a globally recognized system for classifying diseases and injuries. Understanding these codes ensures accurate data collection and analysis. CA, a word that evokes fear. CA stands for cancer, diseases characterized by uncontrolled growth and spread of abnormal cells. Step into the fast-paced world of the ED, the emergency department. ENT stands for ear, nose, and throat. ENT doctors treat disorders of the ears, nose, throat, head, and neck. ER stands for emergency room, handling medical emergencies. GP stands for general practitioner, a doctor who provides primary care to patients of all ages. GYN stands for gynecology, specializing in female reproductive health. ICU stands for intensive care unit, providing life support to critically ill patients. Let's delve into pregnancy and childbirth with OB, short for obstetrics. Obstetricians specialize in pregnancy, childbirth, and postpartum. Now let's talk about anatomical locations, starting with LLQ, which stands for left lower quadrant. Let's move to the LUQ, left upper quadrant. Ensure the doctor understands the patient's discomfort location. Now for an abbreviation with two meanings. PA, which stands for physician assistant or postero-anterior. A physician assistant is a licensed medical professional working under a physician's supervision. Let's talk about a vital component of our blood, RBC, or red blood cell. Red blood cells carry oxygen throughout the body. Now, let's focus on the RLQ, which stands for right lower quadrant. Let's move on to the right upper quadrant. Ensure the doctor understands the patient's medical history and current symptoms. Now, for another crucial component of our blood, WBC, which stands for white blood cell or white blood cell count. You're explaining the body's defense mechanisms and the significance of this blood test. Now for an abbreviation that's become all too familiar, WMD, which stands for Weapons of Mass Destruction. Let's address a sensitive and heartbreaking topic: SIDS, Sudden Infant Death Syndrome. SIDS is the sudden, unexplained death of a baby younger than 1 year old. Now, for a common respiratory symptom, SOB, short for shortness of breath. Shortness of breath, or dyspnea, is a feeling of air hunger or difficulty breathing. Let's discuss TB, tuberculosis. Tuberculosis is a bacterial infection affecting the lungs. That's it for today's lesson on essential medical abbreviations. Mastering these abbreviations takes time and practice, but it's an investment that will pay off in your career. Hit that like button, subscribe to Bell's channel for more medical content, and share this video with fellow interpreters. Stay curious, stay informed, and I'll see you in the next